I'm Cynthia Minkovitz, a professor in the Department of Population, Family, and Reproductive Health at the Bloomberg School of Public Health, and I'm delighted today to be able to share with you some thoughts about women's health policy, the what and why. The purpose of our discussion today will be to get everyone on the same page in terms of what are the approaches to thinking about policy and policy tools, and what is their application in relationship to women's health. As such, our 4 objectives for today are: first, to define policy; second, to identify what is considered to be part of women's health policy; third, to discuss the need for a focus specifically on women's health policy; and fourth, to justify the use of policy to advocate effectively for women's health. Let's turn to the first section where we will focus on what is policy and how should we evaluate it. As defined in the Free Dictionary, policy is identified as a plan or course of action as of a government, political party, or business intended to influence and determine decisions, actions, and other matters. Additional definitions go on to describe policy as a course of action, guiding principle or procedure considered expedient, prudent, or advantageous, and we may have varying thoughts among us as to which policies actually fit this definition as being expedient, prudent, or advantageous. But it's important to note that policy is a much broader construct than simply federal, state, or local legislative efforts. There are 5 elements of policy that I would like for us to consider. First, our policy goals. These goals might relate to enhancing the social order or guiding the distribution of resources, just as 2 examples. In terms of processes, we might think about elections, debates, or legislative votes, some of which receive a considerable amount of attention in the public media. Third, we can consider the venues in which policies take place and are implemented. These might be among governments, such as at the local, state, national, or regional level, or they could be venues in the private sector, such as those policies that are set by corporations or businesses, professional organizations, or even in academic institutions. Next, it's important to consider the policy players and the stakeholders. These might be political parties, elected and appointed officials, government employees, as well as a wide array of other groups, such as labor unions, advisory boards, corporate or executive boards, advocacy groups, or even individual citizens. The outputs of policies could be legislation, as I previously mentioned, but they can also be important outputs such as executive orders that come out of the administrative branches, court rulings, regulations, or taxes. These outputs are considered to be the public articulation of important policy goals. And finally, tools that might be used to implement policies could include licensing, standards, credentialing, contracts, and a wide variety of other tools. There are 4 main types of public policy that I'd like to share with you today, some of which you may be very familiar with and perhaps some less so. As you think about these policies, it's important to consider who is involved in establishing them, who is involved in implementing them, and what are the timeframes in which they are enacted, as well as the extent of public participation. As shown here, statutory policies relate to the Constitution, laws, and court decisions. As such, they involve the electorate, elected officials, and judges, and their timeline for implementation, as well as public participation, can vary widely. Fiscal policies often relate to the legislative and executive branches of government and largely focus on annual budget acts and appropriations. Regulatory policies often involve decisions made by cabinet officers and agency directors, sometimes behind the scenes, and these often relate to administrative rules that are used to implement policy. And finally, institutional policies are decided by agency officials, and these might get embodied in policy manuals, standards that are promulgated, or interagency agreements. It's important to remember that for public policy, these 4 types of policies occur at all 3 levels of government in the United States, at the local, state, and federal level, and they may play out differently among these 3 levels. One example that demonstrates how policies can play out differently at the 3 levels relates to important decisions recently reviewed regarding abortion in the United States. Federal court decisions might determine issues related to constitutional rights, as was decided in Roe v. Wade, whereas state laws and regulations may impose other restrictions such as waiting periods, and local ordinances could be responsible for limiting demonstrations in proximity to family planning clinics. In thinking about policies, it's very important to consider criteria by which we might evaluate whether or not a policy is appropriate and working well. I'm going to suggest that there are 6 criteria that we might consider. Before we continue, think about what criteria you would choose to decide whether or not a policy was appropriate. Here are the criteria that I would suggest as a starting point. The first is effectiveness. To what extent do the policies work, and for which people, under what circumstances, and in what time period? The second criteria, which often receives a fair amount of public attention, is efficiency, often translated into costs relative to the benefits of a policy. The third is flexibility. To what extent do policies respond to changing conditions and changing needs of the population? The fourth criterion relates to equity. Does the policy equally address the needs of all impacted individuals? Is it done fairly? Does justice prevail? The fifth criterion is sustainability. To what extent will the policy last over time? To what extent will the policy be supported over time? The sixth criterion is acceptance. Though a policy can be passed and even implemented and enforced, the acceptance of the policy can be highly variable. And then finally, a seventh criteria which one might consider is the need to minimize unintended consequences, particularly if these unintended consequences are not ones that are satisfactory. You also might consider other criterion which might be important to your areas of interest. There are 3 questions as we think about women's health policy in the United States that I would suggest we might consider. The first, what constitutes United States policy on women's health? How broad or narrowly should it be constructed? You will be grappling with this issue throughout this course. The second, what constitutes policy on women's health in other developed countries? How are these policies similar or different to the approaches taken in the United States? And finally, what constitutes policy on women's health in developing countries? Again, how broadly and how narrowly are these ideas constructed, and how does it vary relative to those policies in developed countries? Now, obviously, those of you taking this course don't need a lot of convincing that we need a specific focus on women's health policy, but I'm going to suggest 3 reasons as to why this focus remains critically important today. First is, despite considerable policy efforts across and within countries, there remain substantial economic and gender inequalities that distinguish the well-being of women and men. The second reason to consider women's health is that we need to consider the implications of multiple roles. In the United States, these roles for women often consider and take into account the roles as wage earner, caregiver of children, caregiver of aging or impaired adults, as well as roles as a spouse or partner of a significant other. And the third reason to focus on women's health is that conditions may be expressed differently and treatments may need to be different for women as opposed to men. So that sums up our initial discussion of what is policy and how to evaluate it. When we return, we will have further considerations about what constitutes women's health policy and also consider some recent activity that has garnered much public attention in the United States regarding women's health.